So hi there. Today we're advocating against ovarian and cervical cancer, and here with me is our special guest and speaker. So she's going to introduce herself to us.
Okay, my name is Dr. Peace Ogaranya.
All right. So Ma, please can you tell us what you do?
Okay, I'm a medical doctor. I'm also the chairperson for the Youth Against Cancer Coalition, Nigerian Cancer Society, and also the chairperson for Youth Engagement Team, Sokoda Summit for End Cervical Cancer Initiative in Nigeria.
Oh my, you're a lot. You're a whole lot. And we'll be so glad to hear from you. So we have some questions about cancer that we'd like you to answer. So Ma, please, what's the most rewarding part of working in cancer care and outreach?
Oh, honestly, the most rewarding part of working in cancer care is that you get to be that one person that is with your patient within the last days of your patient's life to give hope to a person that has already lost hope. Because one thing about cancer management is that most persons already have a psychological breakdown, a mental breakdown. So it takes a lot, because I've seen situations whereby patients lose their family members, they lose their loved ones, not because this person dies, but they are left alone in the hospital, left alone, abandoned, right? So you can just be that one doctor that can just be by the side of the patient, encouraging the patient. You might not do so much in the management, especially in our society where this patient come in late stages, but at least you can give hope to this person. So that is one very exciting thing, and one thing that keep pushing me, because at the end of the day, you know that you can watch your patient happily live, or at least those that come in early stage, you can do something to at least give a cure to that person. Thank you.
All right, thank you so much, Ma. So Ma, I want to ask again, if you can create a cancer fighting superpower, what would it be?
Okay, I love Iron Man though.
Okay, is there any reason?
Maybe because I'm a science fiction kind of person, but one thing I love about him is that the iron fist and what else can just break in and scatter things. So I wish like I can just go in there and just boom, cancer disappears. But what can I do? And also Batman. One thing I also like about Batman is that he's smart. So I can use scientific knowledge to create a cure for cancer, and much better. So I think,
And he has money.
and he has money.
Right. So Ma, also, how has your experience in cancer outreach changed your perspective on the importance of early detection in cancer treatment?
Okay, truthfully, I actually wanted to be a neurosurgeon. Actually,
Wow.
I never thought that I would even go into anything about cancer management. Okay, that is in terms of oncology. But I had an experience.
Okay.
So I was working in a hospital, and then I met a 19-year-old who had squamous cell carcinoma of the occiput, and she's from a very low-income family. In fact, she had only a mother. Her dad was not there. She wanted to be a doctor, and you can see that she was willing to live. She had a lot of hope, and she had a lot of ambition and desire. And as much as I was not really so particular about it, I was curious. And afterwards, I started seeing life differently in her eyes. I started seeing, what can I really do for this patient? What can I do to change the story of this patient? How can I save this patient? And it brings me back to the essence of why you were a doctor in the first place. You know, being a doctor, most persons say they say they want to save life, but we know that you want to at least make money. But saving life is beyond just words. Saving life is finding purpose while doing so. And I think I found purpose because I came to realize that I had to do something different for her. I can help her. I can use the voice, I can use the passion, I can use the medium, being a doctor, to do something for her. And that was it. And my whole life perception changed. And then I was in clinic when a very rich, this person is a rich woman. She's married to a very rich husband. And when she was diagnosed of having breast cancer, I saw the high and mighty wept in my presence, right? She cried. And that shows that money cannot buy happiness. Money cannot really buy health to an extent. So what can really be that gap created between a man and afterlife is that doctor that is able to stand as that gap and help to either push this person either further away or push this person either closer to life. Do you get? So even if it's like I can give them 5 more years to spend with their loved ones. Even if I can push and help them to the extent that they can have 2 more years to tidy up before they go to meet their maker, I think I want to be that doctor, and that exactly is the reason why I chose this field.
Wow.
Thank you.
Thank you so much, Ma. That was really a very wholesome experience, and we are glad that you've taken on this path, and we are sure that with time we would put an end to cancer. So just to remind you, early detection remains key in detection and treatment of cancer. So let's fight cancer together. Thank you.
Get screened and make sure you come early, because there is no way out. Do you get? Right now there is no cure, but when it's detected early, you can do something about it, okay? And in our society, whereby people have several myths about cancer and several myths about the vaccines that can help prevent cancer, please and please meet the right health professionals and get screened, get vaccinated, and we can create a better world for all of us. Thank you very much.
All right. Thank you so much, Dr. Peace.